which is concerning Ramadan and diabetes, and the expert forum that we've had, and the recommendations that are going to come from it are going to be discussed over the next 1 hour. So we really appreciate that all the work that the people who've been involved with this have taken. Mr. Manzoor Binder, who's a patient who's living with diabetes, a person living with diabetes, he'll tell you how long, and he'll tell you his stories as well. So we'll share that, and we'll also share some of the religious scholars' teachings or learnings in terms of fasting as well. So I'm thankful for all of this. So Stop Diabetes Foundation is the organization that is holding this event today. This event today is also in collaboration with Diabetes Canada and Sanofi. So thank you to both of them. My name is Harpreet Bajaj. I'm the founder of Stop Diabetes Foundation, which is a local charitable organization helping in this region of Peel. And I'll talk to you a little bit about this organization in a few minutes. Now, I'm also an endocrinologist, so I'm a diabetes specialist, and I've been practicing for the last 10 years, and I have had many experiences relating to this subject as well. And all of us on the expert forum, you can see all the names there that are basically collaborating to come up with this position statement. All of us have had our experiences in this area, and we've been discussing this position statement and the recommendations for the last 2 months or so. So this is kind of a culmination, and it's good to see that it's coming to a fruitful product that will be used and hopefully will lead to better care for people living with diabetes in Canada who fast or who intend to fast during this holy month of Ramadan. So I'll talk about Stop Diabetes Foundation for a bit. It's a registered charity in Brampton, and our focus is Peel region, so it's a small focus. Of course, we have Diabetes Canada, and we are really wonderful collaboration on this project with them as well. Diabetes Canada is an organization that covers the whole breadth of Canada, and so we are really fortunate to have this collaboration with them. About Stop Diabetes Foundation, we have 2 missions. The first mission is to talk about prevention of diabetes. So as you can see, mission statement number 1 is to reduce the burden of type 2 diabetes. That's the diabetes that happens mostly in older people, and is a majority of diabetes in this area that we live in. And how do we do that? Is by providing accurate information in easy to understand language as well. So that's how we do it, and focuses lifestyle, right? Behavior changes, so diet and exercise. Second mission statement is for people living with diabetes. We want to prevent complications, and so that we can help them live long lives without any complications or adverse effects. Right? And again, the message is simple, talking about lifestyle as well as the right pharmacotherapy so that we can prevent complications. Right? And so that's our 2 mission statements. And as I said, we focus on Peel region, which if you can see on the map here, is highlighted by the blue borders. So that Peel region has this dubious distinction, and it's called the capital of diabetes in Ontario. And the reason for saying that is, according to the Peel Atlas, and according to data Ontario-wide, that Peel has the highest burden of diabetes in the whole of Ontario. This is old data. This is data from 2007 that was used for this. And the thought is that maybe this has even grown further. So according to this data in 2007, about 1 in 7 adults in Peel region have diabetes. And I thought maybe it's changed to 1 in 6 by this time as well. So our goal from Stop Diabetes Foundation is simple, what we call SDF Vision 2020. SDF stands for Stop Diabetes Foundation, and our vision is very clear, 2020 vision. And what is that? To remove that number 1 tag. we want to reduce the burden of diabetes in this Peel region by spreading knowledge, scientifically accurate information, removing myths, and by educating people how to prevent diabetes by leading a healthier lifestyle. And how do we do that, right? So it's a big ask. Of course, we are a very small organization. We are made up of about 50 healthcare providers, all of them Canadian certified healthcare providers. So the doctors, the dietitians, the nurses, the pharmacists. There are many students who are still studying in these healthcare fields as well. So all of these healthcare providers are working during the day. Just like me, I see patients in my clinic. But then in the evenings or on the weekends, we come out and try to educate people, our community, our big family, right? So that's what we try to come out towards and try to educate people to try and reduce this burden of diabetes and also diabetes complications in people who have or who are living with diabetes as well. So with this professional board, as I said, we sit in our clinics, but rather than just waiting for more people to get diabetes, what we want to do is spread awareness about how to prevent this disease. And that's the only reason, for holding such events. And we've been holding these events for the last 4 years or so, and we've tried to reach out to people in our area. And that's the only reason we reach out for media as well. We have no training, we have no intentions of being big in media or anything. The only intention is to spread awareness, and media is wonderful. And we really thank all the media partners who are here today to support the cause as well. Like always, we really appreciate you being here. We also have a website, the Stop Diabetes Foundation website is there, where all this information about all of our events, all our education pieces, some of the write-up material is there as well for anybody to access. We also are there on social media platforms, so YouTube channel, Facebook, there's Instagram, there's also Twitter. And so, I showed you those 50 healthcare providers. There's a single person who's actually handling this, and that's Gagan Gill. She's here somewhere. She's a nurse, and she's the one who handles all the social media for us. She's hiding there, right? Gagan, can you say hi? Okay, thanks. So, Stop Diabetes Foundation on this website is where we will house this Ramadan part as well. Right? So that's where the Ramadan position statement will also be there. Once it is published, we'll have more information on it on this website, so you can access, and healthcare providers can access this as well. Let's talk about this initiative from Stop Diabetes Foundation and the expert forum that we held. So we met together, all of the people that you saw on the first slide met together on March 2nd. But this process actually started 2 months ago with a teleconference to kick off, and then all of us had our homework to do, to look at what is out there, what is the literature out there, and we were assigned chapters on which chapter each one is working on, and then to come up with the best evidence that is available on any of the studies that have been done in a particular field. And then we met on March 2nd at St. Michael's Hospital to discuss all of these things and then come up with some of the recommendations. Over the past 2 weeks, all of the people involved have been intensively, in collaboration over email, over the phone, to kind of finalize these recommendations as well. So that's how this position statement has been developed. This is the agenda for March 2nd meeting that we held. So this is just over 2 weeks ago, almost 3 weeks ago. As you can see, most of the faculty that you saw on the first slide was involved. Also, we've had Dr. Mohammed Hassanin, who's from Dubai Hospital. He's been involved with the Diabetes and Ramadan guideline, which originated from Dubai. He's the chair of that, and he's been involved with this as well. And he was participating in this forum via video conferencing, and he's been reviewing or helping us review the guideline or recommendations that come up from this position statement as well. And at the end, the last, or the second last part, we've also been very fortunate to have religious support for this initiative. It's very, very important to involve our religious scholars, religious leaders, make sure we get their blessings, make sure that that they help guide us as to the correct way of interpreting in the Quran and the specific pieces of information around Ramadan as well. And make sure that their endorsement is there for this position statement, so that we can say that we've taken help from all of the angles that need to be there for this expert forum as well. So I'll ask you some questions, Mr. Binder, about your experience as a person living with diabetes. Right? So first of all, maybe you could introduce yourself, your name, and where your origin is. Where were you born?
Good evening, ladies and gentlemen. My name is Mansoor Binay. I am diabetic since 1983, about 35 years ago, and I'm still sitting in front of you.
How old are you, sir?
I am 78, but 4 months shy from 79.
All right, so 79 almost, and 35 years of diabetes almost, right? And about Ramadan, have you been fasting every one of those 35 years?
All my life, I never miss a fast, because this is from the Creator. He asked us to fast. He asked the people before us, the Jewish people and the Christian. Everybody was fasting. So when he says something to do it, so it's good for us.
So you've been fasting every one of those years, 78 years, right? And so when you developed diabetes, or when you were diagnosed with diabetes,
Yes.
before developing diabetes and after developing diabetes, right? Were there any challenges that you felt during fasting after you were diagnosed with diabetes? Were there any problems?
I had a problem in the beginning when I found out, that I have a diabetes. I cried to, but later on I tried to. I fasted all my life before I was diagnosed for diabetes, and after. I always fast.
And you haven't faced any problems after?
No.
Okay.
I never have a problem.
Do you take insulin or oral medications only? Do you take insulin?
Good.
Do you take insulin?
Yeah, I took insulin for 16 years.
16 years.
Yes, and it was very difficult because I had to take 2-3 times a day, and then after 16 years, my wife requested our physician to please put him on the medication. So the doctors did some tests and stuff, and then he came up, he checked it, and he came up with this. He put me on some medication, and then he said, don't take this insulin anymore.
Right. So with insulin, during fasting, have you felt any challenges, any problems at all?
In this 35 years, I have 3 times I have the doctor called reaction.
Low sugar reactions?
Yes.
Yeah.
So that's what it happened. I remember that. It was during that insulin time. But after that, I learned more about this, and with the help of my doctor, I always listen to him, and I believe the doctors are the best people. They help humans, who we spend all night, who spend their life to make the other people's life.
Were you born in Canada or were you born outside Canada, sir?
No, I was born in India, which was later on moved to from Amritsar to Multan in Pakistan.
Yes, sir.
Yes.
During the partition, probably.
Yes.
And when did you arrive in Canada?
It's about 45, 46 years ago.
45 years ago.
Yeah.
Fasting in India or Pakistan versus fasting in Canada, how is it different? What are the differences?
Pakistan has a shorter fasting day, but over here, I lived in Alberta, and Alberta has 19 hours. In summer, I never missed that. I just fast for 19 hours. And I was working in an oil company, and over there was very hot, but I never felt that I should quit or something. No. Because this is from the Lord, from God Almighty. I believe 100% this has benefit for us. Yeah, so that's why I fast all my life.
Excellent. And what do you think about more education for physicians and diabetes teams regarding fasting in Canada? Because as you mentioned, in Canada, the fasting hours are so long, and maybe the healthcare providers need to be better, focused or talked about or counseled on how to guide people like you, like yourself, who want to fast during Ramadan and how to do it safely. So what do you think about this position statement that we've come up with? Do you think it's a good thing? Do you think it will help people?
Yeah. I think that relationship between patient and doctors are very important to successfully control the sugar, and they should be, beating too often, and a patient should be get educated. Whatever the doctor says, he should be following it, and I believe that's what I am doing. And if you follow the instruction of the doctor, you can control it.
And you've done it for 78 years, so there's no question. You proved that, right? But how about this position statement? So you were there on March 2nd when we met together. You were there on March 2nd, and you saw all of us discussing these recommendations. And what do you think? Is this a good initiative for the people who fast during Ramadan? Do you think it's a useful thing if we come up with specific recommendations or guidance for doctors to help their people, help their patients living with diabetes? This is a good thing?
Yes, it's very good. It's very good. People should be educated, and there's no 100% control of sugar diabetes. In my 35 years time, I have experienced that I try my best, So, but it's never on like natural. It's not that. But you can control it with the help of your doctor, your physician.
Excellent. Excellent. Thank you so much for taking time, first of all, on March 2nd, taking time for the media, taking time to come here, and you're an inspiration for all of us. We've learned so much from you when you're saying that doctors help people, but actually people help doctors as well, because we learn so much from you. Thank you so much.
You're welcome. Thank you.
I think we have solved the technical problem. Let's see if we can play Dr. Peter Sr.'s video, which he sent from Alberta.
My name is Dr. Peter Sr. I work as an endocrinologist, specialising in diabetes in Edmonton, Alberta, at the University of Alberta. I currently serve as the co-chair of the professional section of Diabetes Canada, which is the national organisation which seeks to improve the lives of people living with and at risk of diabetes. I'm very pleased to welcome you here to this special event in Mississauga, the Convention Centre, which has been organised by the Stop Diabetes Foundation and is being held very much in partnership with Diabetes Canada. As you will very well be aware, Canada is a country which is multicultural, and I speak as somebody who moved to Canada from the UK some 15 years ago. The diverse cultures we have in Canada are a real strength, but they also have some challenges for healthcare providers as we seek to provide good and expert information for people from different cultures and with different ethnic backgrounds as to how best to manage their health and diseases that they may be dealing with. For Muslims, Ramadan is a major pillar of their religion, and the fasting that is such an important part of that month can be a major challenge for people with diabetes. I'm therefore very delighted to lend my support to this work that is being done, a consensus statement to provide advice for people with diabetes who are fasting during Ramadan and for their providers as to how best to manage those situations. The guidelines that will be developed, I'm sure, will be of major value and significance for people living with diabetes. And the major focus is going to be around what we would recommend in terms of blood glucose monitoring and changes or adjustments to diabetes treatments during Ramadan so that people can both fully participate in their religious observance but while maintaining good health. So I'm sorry that I can't be with you to participate in the work that you'll be doing tonight and subsequently, but again I wish to encourage you that this is important work that will make a difference for people and to indicate the strong and solid support for this initiative from Diabetes Canada. So good luck, have a great time. I'm sure Harpreet and the others will take great care of you tonight.
Thank you so much, Peter. Again, it's a collaboration that goes beyond the organizations, and it's essential for this position statement as well as the dissemination plan that we have, this continued collaboration as such. I'm going to invite some of the people who've been involved, some of the doctors, the diabetes specialists who've been involved in the operation theater probably all day, and then I'm not sure if traffic is delaying them or not. I'm going to invite the people who've been involved, the doctors who've been involved who are present, so please join us and come up to the stage. Thank you. Maybe I'll ask you to introduce one by one. So Taisir, first you.
My name is Taisir Al-Hassan. I'm an endocrinologist from Windsor.
Hello, my name is Hasnan Khanwala. I'm an endocrinologist at Etobicoke.
Hello, Assalamu alaikum. My name is Tayyib Khan. I'm an endocrinologist here in Milford.
Please voice little up.
Should we do it again, or are you okay?
No.
Okay.
There's no harm in doing that.
All right.
I didn't record it.
So of course, first of all, thank you so much, you guys, for being a part of this initiative and making sure that we come up with, evidence-based guidance around this topic. As Peter Senior mentioned, right, Canada, we're proud that it's such a multicultural, multi-diverse, ethnic background society in our country, and it's part of our constitution as well. In this diverse country, we have different religions, and it's great that we respect all the religious ceremonies and of course Ramadan being the pillar of Islam. is very much cherished here. Now, in Canada, we've not had a guideline until now, or recommendations around Ramadan. So you can say this is the first attempt to come up with a consensus around this. I really thank all the collaboration that we've had over the past few months. So maybe I'll start with asking questions one by one, right? So I'll ask Taisir. Taisir, you've been working on this for a number of years in the area of Windsor. Can you tell us a little bit about that?
For sure. So, when I was a child, my mom's diabetic, and she had diabetes. She was fasting, and she was on insulin, and she'd always have trouble during Ramadan in terms of having low blood sugars. She'd go a long time without eating, and she'd have low blood sugars because of her insulin. And then afterwards, they stopped her insulin and all her medication, and she'll have high sugars. So she struggled a lot during Ramadan, and then fortunately I had the opportunity to become an endocrinologist. And now that I'm sort of in a position to sort of help more people, I've sort of helped not only my mother, but other people in our communities. We set up in the mosque, we have every year we have a community-based program. We have myself, a nurse educator, and other physicians talking to people about Ramadan and what they can do to make it safe for them to fast during Ramadan. We also do programs in terms of helping other physicians who are not familiar with Ramadan, sort of educate them on some of the barriers that people have during fasting and what they can do to sort of help them out.
And Hassan, maybe about your experience with people who intend to fast. What are some of the challenges that you've, as a physician, from that ethnic background, understanding even, it's a different thing if you're not from that background, it's a lot more challenging. But even from that background, have you faced more challenges in Canada, let's say, compare that to, say, Middle East or Pakistan?
Right. I think one of the biggest things is, I guess when I moved to Canada, this was in 2000, and we moved in December in Saskatoon, and it was Ramadan at that time, and it was great because it's like it was from almost 6 a.m. to 4 p.m. Compared to now in the summers, it's going to be almost 18 hours of fasting. So I think that's one of the biggest differences, as Mr. Bindal also mentioned, which makes it a little bit more challenging. In terms of patient care and patient experiences, we at our clinic have started, and again, Gagan takes the credit for it, a pre-Ramadan workshop where patients are invited to come and we give them tips and education on how to prepare themselves. It is also important to obviously see their physician, be it their family physician or the endocrinologist, to make sure that it's safe for them to fast and any medications and so forth are changed accordingly, because so that they don't end up with any complications from either high blood sugar or low blood sugar, which can be quite serious.
And so, Taisir, you mentioned this, and Hassan, so, in your local area or in your practices or in the community out there, you've been trying to educate people as well as maybe other doctors around this topic. I'll ask you, Tayyab, to pitch in on this. So now that we've gotten together and, tried to form a consensus that we think, reflects the evidence or the literature or the studies. Though there's not a lot of studies or research, especially in Canada, there's not a lot of research. So how do you feel about this consensus statement? And we specifically talked about the guideline and the grading of the guideline, right? So following the same grading as Diabetes Canada, the clinical practice guidelines that come out of Diabetes Canada every 5 years. So the same level or grading of evidence in terms of, is it a high-level study or a low-level study? So how do you think this process over the past 2 months or so has worked in this consensus statement?
So, as you mentioned, so there's
Canada has close to your mouth.
So Canada has particular challenges given the variability in the time for fasting. So that's why these guidelines, I mean, they tend to complement the ones that were presented by the International Diabetes Foundation and sort of build on those guidelines, keeping in mind the Canadian variability as well as the medications that we tend to use here. Unfortunately, most of the evidence is not of very high quality. So, we do have to keep that in mind. But I think what we were able to do over the past couple of months is to sort of consolidate all the information that was there and critique it, as a group, and come up with basically consensus, which was unanimous in all the cases, in regards to, how we would grade them, from basically A to D, with A being the highest grade, and D being, based on no evidence, but based on experience as well as personal opinions. So, this is the first, actually, North American effort in this regard. There were position statements by the American Diabetes Association previously, but not to the extent as we went through. But these will serve as a stepping stone for carrying out further research in this area, so that we can educate our respective communities, in terms of fasting safely in Ramadan.
Maybe I'll stay with you, Tayyab, and of course the involvement of religious scholars, which you have led and collaborated with. So can you tell us a little more about that?
Sort of building on what Dr. Abul Hassan was mentioning in Windsor. So we've had the good fortune of collaborating with some of the religious leaders here. Dr. Abdullah Idris Ali is here, actually from Islam. He was, he did talk to us on our second meeting as well. So it is very important to take them and basically hear their opinions about it, because there's a whole lot of misconceptions out in the community. To quote an example, a study from Pakistan basically said that up to about 60% of people would believe that testing their sugars would break their fast, which is not true.
So testing, as in blood,
That's right.
taking out blood,
Taking out blood
which
may invalidate their fast. So getting the opinions of respected religious leaders in this regard, and to convey that message to the public that that is not the case, serves to dispel their myths, and we can only do so much in terms of formulating these guidelines, but actually dissemination, and getting the message across. I think mosques and places of worship and religious leaders have a huge role to play in that regard.
very, very important. So maybe I'll come back to you, Hasnan, and talk specifically about insulin, because many people living with diabetes, type 2 diabetes or type 1, they need insulin in type 1 for sure. But even with type 2, over time, the need for insulin arises, right? And insulin, of course, hypoglycemia or low sugar reactions, as Mr. Binder pointed out, is one of the side effects of insulin. So, in this guideline or in your experience, would you say that we've come up with a consensus that can help guide the physicians and their diabetes teams?
Sure. So yes, as you mentioned, I was given the task of reviewing the literature on insulin use by individuals with diabetes who fasted, and try and come up with some recommendations. Insulin, as you know, is one of the most potent medications to reduce blood sugar levels. So typically, patients who take insulin often have had diabetes for a longer duration of time, and I don't want to use the word complicated, but have a little bit more advanced diabetes in a lot of cases. And insulin use, I think, poses some more challenges if they fast, let's say, compared to somebody who has diabetes and just is controlling the diabetes with diet or with one oral tablet. So the concerns with insulin mostly would be, number one, as you mentioned, was hypoglycemia or low blood sugar, because if they take their insulin and if they fast for several hours, particularly if it's a very long fast, then obviously the risk is that their blood sugar would go down, they would get hypoglycemic, which can be a very dangerous thing potentially, and can also lead to coma and seizures if not corrected in time. On the other hand, if they don't take insulin because of concerns about low blood sugar, they can end up the opposite, hyperglycemia or high blood sugars, which again has its own sets of problems. So I think the guidelines recommend that individuals who take insulin, particularly if they are on more than one shot of insulin, are considered to be at a higher risk of potentially developing complications while they fast. And it is very important that they meet with their physicians or healthcare providers prior to Ramadan to make sure that it's safe for them to fast. And what we've tried to do is looked at the literature and tried to come up with some recommendations. And again, the object of this is not to go into details, but there are different kinds of insulins. Some patients need to take insulin once a day, some patients need to take insulin 2, 3, 4 times a day. So we've come up with some recommendations to see whether it's safe for them to fast, if the insulin that they're on needs to be changed before Ramadan, both in terms of the kind of insulin, and then more importantly, of course, is how much dose do they need to reduce, and the timing of the insulin. So those are some of the things that we've looked at the literature and have come up with some recommendations in our guidelines.
Thank you. Taisir, so you were assigned the non-insulin therapies in type 2 diabetes, and you've done a fabulous job on making sure that we have evidence base, because there's more studies that maybe are applicable in this non-insulin therapies or treatments. In general, many of the non-insulin therapies may be safer, but there are some caveats, there are some nuances, there are some challenges or problems that we need to pay attention to, even in non-insulin therapies or people who take oral medications as well. Can you elaborate on this piece, please?
So right now is a great time to be in diabetes, to be treated for diabetes. There's so much new medications out there. And so the majority of these medications are focused on helping to lower your blood sugars, helping to lose weight, but more importantly, less risk for hypoglycemia or less risk for low blood sugars. And so that's what's been the focus for most of diabetes care outside of Ramadan. During Ramadan, we're doing the same thing. We're trying to focus on not having low blood sugar so people can fast safely. So the vast majority of the medications are safe for that. There's one group of medication, sulfonylureas, or in the classes diamycon or glitazide. These medications, they can cause low blood sugars, and so we have to sort of pay attention and adjust these medications. Another class of medication that's sort of newer and people are more and more patients becoming on these are what we call SGLT2 inhibitors. These medications, the way that they work is they sort of help you control your sugars by having you pee out the extra sugar that you have in your system, which is a great way of losing weight, controlling your blood sugars with no risk for low blood sugars. But during Ramadan, it's going to be an issue because already in Ramadan, you're going 17, 18 hours without eating or drinking. And this could put you at risk for dehydration. So again, this is something you have to consider with this class of medication. Another class of medication that's sort of, again, becoming popular are the injectable, what we call incretin-based therapies, the GLP-1 agonists. And these are injectables, and again, they're great medications. They control your blood sugars, they help you lose weight, and there's no or low risk for hypoglycemia. But one of the biggest side effects of this medication is nausea. And already in Ramadan, you're going a long time without eating. And you don't want this issue to happen during Ramadan, so we don't recommend to start this medication prior to Ramadan or during Ramadan. So most medications are safe for you to continue, and of course you'll get advice from your family physician or from your endocrinologist in terms of which ones are safe and which ones aren't. But specific medications sometimes have to be addressed during Ramadan.
As you mentioned, this position statement or the consensus with the grading will hopefully help the diabetes teams out there in Ontario, in Canada, as well as the doctors who who are faced with this as well. Maybe I'll finish off by saying one of the key things that is coming out of this consensus statement is that people should seek medical advice, or their diabetes team. They should seek their advice at least 1 to 3 months before actually the Ramadan fasting happens. As you said, some of these medications, if they've been on these medications for a while and they're tolerating it, there's no problem with continuing with these medications. But what we don't need to happen is, what we want to avoid is, starting these medications right before Ramadan or the day of the Ramadan fasting, and that can cause problems, right? So seeking advice 1 to 3 months before actual Ramadan starts, I think is one of the key messages. The second key message, which you all, so wonderfully stated already, is safety first, right? So there is a sense of this that we want to be safe in terms of helping people, perform their religious fasting while making sure that they stay healthy and safe as well. So that's the key message as well. And maybe we'll also, when this position statement comes out, we'll also talk about when to break the fast as well. When is the right time? If somebody is, God forbid, having a low blood sugar, when to break that fast would be another thing to talk about. So thank you so much for all three of you to join us here and for the collaboration. There's a lot of work ahead, so let's keep working together on this. Thank you. Maybe you'll get a picture. He wants to get a picture.
Look close, man.
It's good.
One,
Cozy.
1, 2.
Okay.
Thank you.
We'll stay here. We'll ask Dr. Subodh Verma, who's just joined us, to come up as well, and we'll take another picture. And then I'll ask Dr. Subodh Verma to introduce himself. Are you coming right from Operation Theatre? Or? Is Dr. Ehsan here as well?
Sir, excuse me.
1 second.
One second, but you keep
Can I have a picture?
your camera.
Okay, let's not fight. Let's be nice to each other.
1, 2. Thank you.
Okay, thank you. And Subodh, please join me here. So I'll let you introduce yourself, Subodh.
Great. So I'm Subodh Verma. I'm a cardiac surgeon at St. Michael's Hospital and also a professor at the University of Toronto. And I'm really delighted to be here. Big congratulations to Harpreet for his tremendous leadership in this very important area. You may not know the history of how this actually came to be. And here's Dr. Asim. Actually, we're waiting for you, man. The two of us were operating together on a patient with aortic stenosis this afternoon, and that's why we got a bit delayed. We'll get you to introduce yourself as well.
Hi everybody, my name is Mohammed Hassan. I'm a cardiac surgeon at St. Michael's Hospital, working with Dr. Verma. So excited to be here, really privileged. Great work here.
Thank you, and thank you for all the work that you've done for this as well. But Subodh, maybe you were telling us a story of how this came about.
So the way this came about is, as you know, South Asians are at higher risk of cardiovascular disease, and we end up seeing a lot of patients who need bypass surgery who have...
Can you have my
We have a lot of patients who are of South Asian ethnicity who require bypass surgery. And over the last few years, the two of us have observed at St. Michael's Hospital at least 3 distinct cases where people, a few weeks after having had bypass surgery, when we see them in the office, they've had a quadruple bypass, and they wonder about fasting during Ramadan. And first and foremost, oftentimes when physicians give usual advice, you should be compliant to an ACE inhibitor, a statin, glucose lowering, etc. That's pretty prescriptive, and we're very comfortable with that. But when it came to these topics, it was extremely difficult. And in fact, I found that even though I was giving advice to individuals to say you should not fast, during this month you just had heart surgery, the response back was, but it is the fasting that actually will make me stronger and will get me through this. So, again, the need for physicians to be culturally sensitive and understanding the roots and the gravitas of Ramadan and what it means to people was imperative. And then I ran into Dr. Hassanin, as you know, in Dubai at the IDF meeting, and discussed this with him as he is leading a similar initiative as you are in the Middle East. And they've thought about this quite extensively. And I came back to Canada, and of course, who's better than Harpreet to actually move things forward in these kinds of areas? And Harpreet and Dr. Hassanin actually took the bull by the horn, if I may, and assembled this really outstanding group. So I think there is a great need. There's about 1.2 million Muslims in Canada and growing fast. It's 60% of people who live in Toronto were not born in Toronto. And I think it is about time that we had some guidance for people to actually provide to our patients about safety and efficacy. And also, there is a great need for physicians to understand the cultural roots as to why is it that people fast? Why is it so important? And how can we incorporate their ideas and their plans into a culturally sensitive and safe sort of mechanism. So this is a great forum. Congratulations to all of your panelists. My job, my only role here was to actually make sure that this idea did not lose momentum, and I'm extremely thankful to you, Harpreet, for making sure that it's actually...
We are thankful to you for germinating the seed and also making sure that we stayed on track as well. So thank you so much. Dr. Ihsan, I'll ask you to comment on so what Subodh mentioned, right? Okay, thank you. So Subodh mentioned that even in the religion, there are allowances for people, so that some of the people who are sick, maybe pregnant women, maybe people who have complications, for example, a recent bypass surgery, let's say, to be an allowance is there for people that they can excuse themselves from the fasting month during that time as well. But as was mentioned, and others like Mr. Binder have mentioned as well, that it's their passion and it's their belief that that this fasting month will actually make them stronger, and still they want to fast. So what, as a physician, how do you deal with that, or how do you acknowledge their beliefs and also advise them, counsel them?
Yeah, so this has always been a very difficult question. Even as a Muslim and as a physician, I find it very difficult to answer, because they know there are no clear-cut guidelines. And it's a very individual-based question as well. Many times, like individuals who have recently gone through surgery or have medical problems, they go and ask their imams what to do. Should I fast and should I not fast? And imam usually say, go and ask the doctor and just do whatever he says. That should be good. And unfortunately, even Muslim doctors don't have any guidelines to suggest whether an individual should fast or not fast. So I think this forum and your work to bring up all those guidelines to educate doctors, whether Muslim or non-Muslims, how to treat these patients and how to advise these patients is very well needed. So excellent work here. And it's such an individual, you can understand, Muslim, an individual is fasting from the age of 14 and 15 to 16, and they fasted it's a part of their culture, a part of their religion. And then when they are old, just to tell them not to fast, it's a very difficult decision. And sometimes, even willingly, they are happy to take a risk to their life. That okay, that's fine, I'll take a risk and fast, and God will take care of it. But we need to understand, I'm not an imam here, but where God has asked, or Allah Ta'ala has asked people to fast, He has Himself has given concession not to fast when it is required not to fast. But sometimes it's very difficult to think that or to get that message clearly. I think here our imams have to play a role to reinforce. Just for an example, like when Muslims travel, they are allowed, or actually they are asked to shorten their prayers. But at the same time, when they are sick or if there is any Sharia reason or a legal reason for them not to fast, I think it's important that they shouldn't fast as well.
Thank you. Thank you for being a part of this, Dr. and thank you for making it to this event as well. We look for further collaboration in making sure that this message and the collaboration with the imams, as you mentioned, keeps moving forward. So thank you so much.
Thank you so much.
Thank you. And now I invite Jovita. So on the agenda, Dr. Jan Hutz, the president of Diabetes Canada, is mentioned, and until this morning that was confirmed. However, Jan has been battling a flu over the past 10 days or so, and she was not feeling well. And so, Jovita, thank you so much for joining us. Please have a seat. And I'll let you introduce yourself, Jovita, first.
Hi, my name is Jovita Sundarabhuti, and I'm the VP of Research and Education at Diabetes Canada.
And how long have you been with Diabetes Canada, Jovita?
20 years I've worked there.
Yeah, so you know all about it, right? So let's talk about Diabetes Canada for a bit. So what is the mission, and how long has it been going, and what do we intend to do?
So Diabetes Canada was founded by Dr. Best. So we've been around since the 50s, 1950s. We just last year changed our name. We were the Canadian Diabetes Association, and now we're called Diabetes Canada. The mission of Diabetes Canada, I know Peter Senior did mention it, it is to prevent, help people in the fight of diabetes to prevent complications, and as well as to fund research to find a cure for diabetes. So that's the mission.
Yeah, excellent. And then, so Diabetes Canada has guidelines in general for healthcare providers and other people as well, people living with diabetes, other people who help them. And these guidelines come up every 5 years, right? So this is actually the year 2018, and we'll have them next month, within the next 2 weeks. I'm sure we're very busy with the preparations for that. So taking time out, I'm very thankful for you for doing that. Now these guidelines, until now, we've not had a specific part of the guideline be focused on Ramadan as such. And so in that sense, when we started talking about this position statement, we thought this was going to be complementary to the guidelines that come out every 5 years from Diabetes Canada. Can you elaborate on that part?
Yes, so first of all, our guidelines will be released April 9th. So these are the 2018 guidelines. And after this year, we will be updating our guidelines annually, but it won't be the entire 38 chapters that will be released on April 9th. So we are really excited about this position statement in particular, because we really understand that this stakeholder group needs attention. We really were not able to do the work that needed to be done, so we are really happy to collaborate with this group, and we'll be able to help disseminate the recommendations and the position statement once it's published.
Absolutely. And so I mentioned Stop Diabetes Foundation. Our focus is small, we are just volunteering for this, but Diabetes Canada has this huge potential, and people who cheer for this and volunteer for this organization, and such guideline can help people in Vancouver and Calgary, Montreal, so all those areas. And we look for further collaboration in this respect. So about the dissemination of this position statement specifically, how do you think we can collaborate? Of course, we'll discuss some of the key things that we can collaborate on.
So the first one would be when the position statement is submitted to the Canadian Journal of Diabetes. That will be published and distributed to 5,000 plus healthcare providers across Canada. As well as Diabetes Canada has a professional membership that's made up of 4,000 plus healthcare professionals who are working in diabetes, so we could communicate to them. We do have a lot of social media platforms where we communicate to healthcare providers as well as people living with diabetes. Diabetes Canada has presence across Canada, so we have staff in every province except Quebec. But we do work with Diabetes Quebec very closely, so we will be able to leverage all those assets to help get the message out.
Excellent. On behalf of Jan Hutz or yourself, would you like to give a parting message?
So we're just glad that this is being done, and we hope that in the future that we'll be able to incorporate this position statement into our guidelines, because the first process in adding new chapters to the guidelines is to have a position statement developed, so you're way ahead of the game. And so once that is done, then we will look at how much more literature gets published on that topic, and then hopefully in the near future have a chapter on this in our document.
Yeah, and hopefully this will also generate more research into the area, as was mentioned by previous faculty. There's not a lot of research in Ramadan in Canada, and so that's where we need to generate some research as well, so that we can actually be confident in our recommendations much more in Canada as well. So thank you so much, Jovita, and hopefully hope that JANHUTS gets really well very soon.
Thank you.
Thank you. Dr. Hisham Mahmood to join us on stage. So industry collaboration is very important for any initiatives, and I'm thankful that industry broadly has collaborated with this initiative. Now today's event is in collaboration with Sanofi, and Dr. Hisham Mahmood, I invite you to join me on stage.
Thank you.
Yes, thank you. So have a seat, and we'll ask you to introduce yourself first.
Okay, thank you, Dr. Bajaj. It's a pleasure to be here. My name is Hisham Mahmood. I'm the head of medical affairs for Sanofi Canada. And again, very proud to be part of this initiative.
Excellent, thank you so much. And Hisham, tell me about your life story. Were you born in Canada, or when did you move into Canada?
Okay, so I'm Canadian since 2010. However, I was born in Cairo, Egypt. The last 20 years of my life before coming here to work for Sanofi Canada, that was like 1 year back, was spent in Dubai. So I've been again working in Sanofi Middle East platform and Central Asian countries. I'm a medical doctor by education. I was graduated from Cairo University in 1994. I had some postgraduate education in general surgery, actually, and thereafter in oncosurgery as well.
Oh, excellent. So as a doctor and as a Muslim, right? You've been fasting for Ramadan yourself, and what are your experiences fasting in Egypt, in Dubai, versus fasting in Canada?
Yeah, okay. So that's a very interesting question. Thank you. So Egypt was basically that childhood fasting. So that was basically, there were a lot of tradition. It was a lot of fun, I have to say. When you grow up in your professional career, so this is more on Dubai and thereafter Canada, it's basically how to juggle your professional life with fasting, and you need to get a bit organized when it comes to that regard. What Canada have factored into this equation are the long fasting hours.
Let me interject. So in the Middle East, or in majority Muslim countries, the peers, all of the peers are fasting during that month, right? And does that help, or do they get shorter work hours during the fasting month as well? And does that help?
So that's a very good point. So you get like a flexi hours. So the total number of hours are more or less the same, but you can have some flexibility on when to start and when to end your working day, so that you can basically provide some flexibility to attend to your fasting practices. But that's being said, again, I think that in terms of everybody around you, again, my last 20 or 20 plus years were in Dubai, where it's a very, I would say, diversified culture. So there were a lot of my colleagues were fasting, but still, again, we had a big number of colleagues that not of Muslim faith. Yeah.
And so you were talking about the long hours in Canada. And did you fast last year?
So yes, I did. So I've experienced that last year, and indeed, maybe the first few days you might find it difficult to get used to it, but I think after the first week, it kind of normalized, and
so you
take it as it comes.
Yeah, and you get more stronger as the fasting progresses, I'm sure.
Exactly.
And so let's talk about Sanofi and your experience with Sanofi, especially with Dr. Hassanin, who we are just going to hear a video from, right from Dubai as well. So Dr. Hassanin is the chair of the International Diabetes Federation Diabetes and Ramadan guideline that comes out of Dubai. And I've seen some pictures of Hisham with that board as well. So tell us about Sanofi's collaboration with that guideline.
Absolutely. So again, I was very fortunate to be part of this initiative 2-3 years back. Sanofi as a company is one of the companies beyond providing and being one of the leaders in providing pharmacotherapy to diabetes is very much having the priority of enabling patients of different ethnicity, different backgrounds. So we've always had in mind to establish those platforms of having people with diabetes empowered toward this disease and being able to manage it the best they can. So this was one of them, and definitely in the Middle East, Muslim faith is basically the faith of the majority, and Ramadan cast a challenge for those who practice fasting during that holy months. So I was fortunate to work with Dr. Hassanain and to work with the IDF as well, and I think we've hosted the first events where the IDF guideline was dispatched. We've had some religious scholars as well that had endorsed the guidelines. We get, I think, the endorsement from like 6 or 7 Ministers of Health from different Middle Eastern countries. So it was a great initiative. Again, very proud to be part of extension and the second chapter of this initiative here in Canada. And it's a very interesting, I would say, initiative to contribute to and feel a belonging to. Yeah.
Thank you. Last question. So people and empowerment, you mentioned, right? Empowering people. And Sanofi has this Raise Your Hand for Diabetes. So tell us a little more about Raise Your Hand for Diabetes.
So thank you very much for bringing this, Harpreet. And again, this is again one of the enabler platforms that we're having. So Sanofi Canada have created Raise Your Hand. It's a digital platform, not only for people with diabetes to get some educational tips, but as well it provides this platform to interchange information, showcase champions, those who really have brought some inspirational, successful stories and how they manage their disease. We've had a fundraising last year of, I think, more than 100,000 Canadian dollars that being contributed to Diabetes Quebec and Diabetes Canada. There has been a roadshow across the country for some educational activity and healthy lifestyle. So indeed, beyond the pharmacotherapy, we try to build those enablers that will empower people with diabetes everywhere in the world.
Absolutely. Thank you so much, Hisham.
Thank you, Dr. Bajaj. Thank you very much.
So as I said, industry collaboration is very, very important. We've come a long way in diabetes management over the past 20 years or so. And part of that is because we've developed, or the industry has developed with collaboration from many of the researchers, medication that can help control glucose levels with, as well as being safe with less side effects as well, right? So that's been what has happened over the past 20 years, and we've seen that because of that, partly, and because of greater knowledge and dissemination, that complications of diabetes overall have come down over the past 20 years. So we see less amputations of the legs, less dialysis, less heart attacks or strokes in North America for people living with diabetes compared to what used to happen 20 years ago as well. So we've come a long way, and hopefully, I'm taking it broader compared to what we are here for, but this collaboration is needed in the future as well. Okay, we'll finish off with this video message. You've been hearing, or we've been talking about Dr. Mohammad Hassanain. And Dr. Hassanain is in Dubai, and he sent us this video. Now this whole program, March 20th, the date was decided because Dr. Hassanain was supposed to be here again. But he has some medical illness come up as well. He's actually scheduled for surgery next week. And so we wish him all the best for that. He couldn't be here, but he sent us this video, so let's take a look at the video.
Welcome everyone. It's a great pleasure to be with you. My name is Dr. Mohammad Hassanain. I'm a consultant endocrinologist at Dubai Hospital in the United Arab Emirates, and I'm also a senior lecturer at Cardiff University. I have the pleasure of being in Durham, which is that Muslim Ramadan International Alliance Chairperson. For many years we've been concerned about diabetes and Ramadan, and I'm delighted that many people among yourselves have taken that opportunity to develop this important Diabetes and Ramadan Canada statement. I would like to specifically thank Dr. Harpreet Bajaj and Dr. Verna for their support for this initiative and their contribution, as well as all the authors of the statement. I also would like to thank very much Stop Diabetes Foundation and Diabetes Canada. Fasting during Ramadan for a Muslim person could be a great challenge. This challenge is certainly observed in Canada in view of the long fasting hours over coming Ramadan and the future of Ramadan as it happens during summer months. So the fasting could be good 18 to 20 hours in many cities across Canada, which minimize the hours of eating. Certainly that could be a challenge for many people with diabetes. While there is recommendations which could include the scientific as well as the religious opinion, and with allowing a good number of people with risks during fasting Ramadan to be exempt from fasting, nevertheless it's important that we have the Canada statement, as every country has its own circumstances and its own management, availability of medication and services. I welcome this statement very much. I had the pleasure of contributing and being part of the authorship of it, and I feel that it will help many people. It's certainly a start, and I hope that in the future we'll have more solid regional information from Canada and from North America to help the Muslim people with diabetes living in this part of the world and wishing to fast Ramadan. Even if you don't fast, it would be important to have some information of how can they best go through Ramadan happy and in safe mode. I would like to thank you all again, and please accept my apologies for not being with you in person. Thank you.
So if we can switch back to the slides, please, yeah. So helping people is why we became what we are, right? So healthcare providers, or even people, helping people is one of the things that we should continue doing. And that's the essence of this position statement, is to help people go through their religious fasting in a safe manner, and that's the whole idea behind this as well. So if we go to the slide review, here's the next steps for what we're talking about. Can we switch to the slide review mode? Or the slide show mode? Do you know how to do that? Okay. Okay. So we'll move forward as fast as my fingers can move. Here. And next steps. So what are we to do? This is just the beginning of this work of helping people. The next steps, one of the next steps is to continue our collaboration and guidance from our religious leaders, and we are very thankful for the religious leaders who are here as well to support this initiative. Also, we need review, and this will be international review of the position statement recommendations. So here's some of the people who will be involved in terms of reviewing this. Many of you who are here have already asked or reached out to you to seek help to review this as well. So thank you for saying that you will review this and make sure that we're coming up with a solid evidence-based statement as well. And then after that will be the publication in a Canadian journal, the Canadian Journal of Diabetes, and then the dissemination in collaboration with Diabetes Canada, as was mentioned by Juvita as well. So those are some of the next steps. So there's more work, so all of us need to collaborate, continue to do that. Now with Stop Diabetes Foundation, we have a tagline or a motto, and it is that together we will stop diabetes. In the sense that not one person can do it, not 50 people can do it, but we need to collaborate, to reach our mission. And I hope the same goes for this position statement as well, that we all keep collaborating to take this to the next level and make sure that people can actually get benefit of this position statement and develop further research as well as solidify the recommendations as well. So with that, I would like to just thank you all for being here, all the attendees, all the panelists, everybody who was involved with this effort, as well as the media who are here, and the Media Works team who's been working so diligently on making sure that all the organization goes very smoothly. So thank you all. Dinner will be served. They're getting ready to do that. And we'll end with prayers for those of us who want to join the prayers, which will be held outside and led by, of course, the imams as well. So please stay and mingle and maybe share your thoughts on how this evening was, or this initiative, or talk about what should be done further to help us disseminate this position statement as well. So thank you.